Today's topic, and for the next 3 weeks, is going to be about pregnancy training and basically any modifications or things that we may need to change during pregnancy, but also specific to each trimester. So today I'll be talking a little bit more towards just trimester 1, so that first sort of 13 weeks of pregnancy, and then I will be moving into trimester 2 and 3 as we go. So with pregnancy, like a lot of training during pregnancy in the first trimester generally just comes down to logic and not being ridiculous, right? So it will be very different compared to like somebody who is training at a high intensity, say 5 to 6 days a week, or perhaps they're a power lifter. That's going to be a very different approach to somebody who potentially is like just walking as their daily exercise. So we're going to be chatting a little bit about the changes that need to happen on both levels of the scale, and just basically having a really clear understanding of why and how we train during pregnancy. So the first thing I like to sort of speak about is the goal. So there's always going to be, with any phase of, health and fitness, if there is a goal related, then we need to make sure that the, exercises we're prescribing, the intensity, everything is actually going to help hit that goal, but it needs to be realistic as well. Now, especially during pregnancy, and everybody has a completely different pregnancy journey from start to finish. Potentially some people have gone through a longer fertility journey, which means there is going to be a little bit more, I guess, sort of anxiety around training and getting active or maintaining a certain level of training. And that is completely understandable, because whenever you're going through any kind of challenge, you want to take out any kind of risk that is going to, potentially impact that. So I want to first of all talk about the goals around pregnancy training and the importance of pregnancy training, especially as your body continues to grow and adapt. So when we're looking into why we want to train during pregnancy, there are many things, but I like to always just bring it back to mobility, strength, and maintaining sanity. So for me especially, your hips will start to shift, your pelvis will shift, and then you will naturally start to get an increased curve in that lower spine. So to help mitigate that, we want to make sure we are working and maintaining the muscle around those areas, but also working on the postural muscle so we aren't slumping and making that worse. Because we know that with pregnancy comes some discomfort. So if you can try and work with that or mitigate that as much as possible, then that is a win in my book. So how do we do that? Well, like I said, we want to speak about working through strengthening muscles and working on the balance of your body. So working through unilateral movements, the least complicated one that we'll be speaking about. Intensity is basically, just be smart. You will need to adapt intensity slightly in the first trimester. Rather than pushing towards max effort of like a 10 RPE, then obviously we want to be pulling back closer to sort of 8 or 9 RPE and not sort of sticking to, aiming for that high rep, because again, it comes down to context of why are we moving? We're not moving to, hit PBs. And this can be a big mental shift and a really tough thing to have to change and adapt, especially in those first 13 weeks when maybe you haven't told people yet. And, you're going to a gym or you're training with a friend or something like this, and you have to make modifications, or you're not going as, hardcore as what you used to be able to. And that could also come down to how you're feeling during those first 13 weeks, especially if you're somebody who does experience the nausea and, feeling that quite morning sickness and feeling unwell as well. So things that we do really want to remove, like straight away, it's not worth the risk, right? And by risk with this particular exercise, so we want to remove direct core crunching, so anything that is going to really apply intra-abdominal pressure. So think about your core, your diaphragm, and as you are squishing that down, it is also going to be spreading out, right? Now, what we want to avoid, if we can, is or reduce the amount of abdominal separation, because the further our abdomens separate during pregnancy, then the further we also need to work on the rehabilitation in the postpartum journey. So if we can manage that as best we can during the 9 months, then of course we're going to be really complementing that postpartum journey and getting back into training afterwards as well. And then things you can continue is going to be the isometric core work, so such as planks, tabletop positions. Side planks are really good. You can do them pretty much all the way through pregnancy. But forward planking, so on our forearms, that's something that you do want to probably take out definitely in the second trimester. And depending on, of course, your form and how you're feeling, probably also as you start to head in towards the end of trimester 1. Now, are you causing any issues or, causing complications if, let's say, you've been training and you're training through and 8 weeks you find you're pregnant? Probably not. There is no real link between exercise and miscarriage in those first 13 weeks. But again, it does come down to what your fertility journey is and what you're comfortable in doing. There is a lot of, there's not a lot of black and white when it comes to pregnancy training. There is a lot of gray area. So it is a little bit, taking everything with a bit of a grain of salt. So why don't we have to change too much in the beginning? This is due to there not really being much weight gain, and then there's actually minimal physical growth within those first 13 weeks. So you'll see some people will, pop within the first trimester. Some people you won't even notice at all. And because there aren't many biomechanical changes to your body and structure in the early stages, so there won't be a need for as many changes to technique or range as there is when we start to shift into trimester 2 and 3. So there's contraindications that come with pregnancy, and they can be severe fatigue, nausea, sickness in the first trimester especially. And if this is experienced, then training will become quite difficult, obviously. You could be somebody who does experience, pelvic pain or SPD pain, and you could be somebody who experiences high blood pressure. So again, everything is quite contextual to you and your pregnancy. What we do want to do though is just remove any exercises that increase that nausea or that dizziness feeling. So anything like plyometrics or, getting up and down too much. If you are, feeling dizzy or feeling quite nauseous, then changing a full burpee from the ground up to maybe a modified burpee or a modified push-up. Anything that allows you to still be somewhat elevated is going to help, and not going from ground to, feet to floor too regularly. So let's look at basically a bit of a summary. Trimester 1, like I said, is probably one of the least complicated stages of pregnancy that you do need to change. Given that you are feeling well enough, I think it's really important to just have gratitude towards still being able to move, have gratitude towards the immense changes that your body is going and about to go through, because this is going to be a bit of a journey. And I think it's as much a mental journey as it is physical, and especially for somebody who is used to, training at a higher intensity, and potentially somebody who had started a new training phase and they have new goals in mind and weren't particularly prepared to get pregnant at that stage, or weren't planning on it, or weren't expecting it to happen so soon. That's where it can be really hard to shift from one set of goals or one path to then have to start to look at making modifications or seeing your body change when you may have had a different vision for it in that, 6-9 months coming forward. So how do we overcome that? How can a coach help you overcome that? We want to set some realistic goals, put it into perspective of exactly what it is that you're going through, what your body is going through, what is realistic, and then also preempt what to expect as well. Because if you do go into pregnancy thinking, oh, this is great, I'm just going to train all pregnancy, it's going to be fantastic, but then a potential complication does come up, then it's really hard to have to adapt and change your mindset around what you could do or what you thought you were going to be able to do, to then have to, dial it back and make those changes. So just because there are no real big changes in the first trimester, it's not necessary to completely take out everything. We can do most things. Things that we do want to avoid, obviously, is that direct crunching. Any sort of forward planks, we can modify that, especially towards the end of trimester 1 into trimester 2. Your intensity, it does not need to, we don't need to be hitting the, PBs or going for an RPE of 10. It is about being logical, being smart. So you want to just watch that level of exertion. Again, it's just not worth it, right? And no matter what your fertility journey is, whether there is a direct link or strong link or not, it's just not worth it. And again, of course, that comes down to your perception. But you want to just listen to your body, allow for adequate rest. This will be one of the things. Rest will have to go up as intensity comes down as we move through the trimester 1, 2, or 3. And just keep an eye out for any red flags or, signs of contraindications that might be coming up. One of those red flags could be anything like feeling dizzy, having low back or lower abdominal pain during exercise, even the following day, feeling of any heaviness or dragging sensation through your pelvic floor, because as we do start to grow, our pelvic floor will start to weaken as well. And being mindful that pelvic floor exercises are fantastic and definitely should be commenced, from the start of pregnancy. I always recommend to actually have your pelvic floor assessed by a women's health physio first, just to see if you are holding or bracing correctly, if you're doing your pelvic floor exercises correctly. But also there's, it was kind of like if you were experiencing any pelvic floor pain or symptoms. Hi, Kate, thanks for jumping on. Then one of the things were, you must have a weak pelvic floor. Now there's actually a lot of study to say that you can experience very much some of the same symptoms if you have an overactive pelvic floor as well. So I definitely do recommend going to get pelvic floor checked and just assessed by a women's health physio first. See where you're at and see what particular exercises and ranges that they may prescribe for you and your particular situation. But some red flags that you want to think of, if they do happen, if you do experience any leakage during training or thereafter, pain, and also if there is any sort of dragging sensation, any dizziness or excessive nausea or fatigue following the training session, then that again is going to come down to intensity as well. So intensity and load. So there's a few red flags that you want to start to be aware of from the very start. Again, like I said, if you find out 8, 10, weeks into your pregnancy that you are pregnant and you had been training the same, no, you are probably not causing any, complications or issues, but it is really important to be aware of where you're at, the level of your pregnancy, your gestation, and everything like that. And just always bring it back to the goals around pregnancy training. I know for me, definitely it's around movement, mobility, and being able to just nourish my body with movement as well as good foods, not just my body, but also the baby. So if you are applying additional and too much stress to yourself, then your baby is also experiencing that as well. So I won't continue on too far into this topic, as next week I'll be talking on trimester 2, a little bit more about some modifications to certain exercises, But yeah, today was just about trimester 1, focusing on the goals, the how, the why of pregnancy training, and bringing it back to that. So thank you. If you did watch this back on replay and have any questions, feel free to jot them down below or just reach out to me either through here, this group. If you do have any friends that are pregnant at the moment and, you know, potentially a little bit wary about pregnancy training and looking for some help or advice, feel free to tag them in or let them know if they want any extra support to reach out as well. Thanks so much, guys. Have a great day and I'll see you next week. And basically any modifications or things that we may need to change during pregnancy, but also specific to each trimester. So today I'll be talking a little bit more towards just trimester 1, so that first sort of 13 weeks of pregnancy, and then I will be moving into trimester 2 and 3 as we go. So with pregnancy, like a lot of training during pregnancy in the first trimester generally just comes down to logic and not being ridiculous, right? So it will be very different compared to like somebody who is training at a high intensity, say 5 to 6 days a week, or perhaps they're a, you know, power lifter. That's going to be a very different approach to somebody who potentially is like just walking as their daily exercise. So we're going to be chatting a little bit about the changes that need to happen on both levels of the scale, and just basically having a really clear understanding of why and how we train during pregnancy. So the first thing that I like to sort of speak about is the goal. So there's always going to be, with any phase of, you know, health and fitness, if there is a goal related, then we need to make sure that the, you know, exercises we're prescribing, the intensity, everything is actually going to help hit that goal, but it needs to be realistic as well. Now, especially during pregnancy, and everybody has a completely different pregnancy journey from start to finish. Potentially some people have gone through a longer fertility journey, which means there is going to be a little bit more, I guess, sort of anxiety around training and getting active or maintaining a certain level of training. And that is completely understandable, because whenever you're going through any kind of challenge, you want to take